Hello, good afternoon. I'm Swapna from Department of Psychiatry. We will be discussing about introduction to the topic of psychiatry. Yes, psychiatry is quite an interesting topic and we'll be discussing about it. So to start with, I was wondering what should I teach you people in psychiatry? So let us start with who is normal and who is abnormal. Is there a definition for that or there is no definition about it? So let's check with it. So, what is the definition of WHO? Who is having a normal health and how we define the normal individual psychologically? So, WHO defines health as a state of complete physical, mental, and social being and not merely absence of disease. Psychologically, normal person are those who are in harmony with themselves and with the environment. There are different models of normalcy: medical model, statistical model, utopian model, subjective definition of normalcy, and there is a social definition of normalcy. The medical model defines that the individual should be physically fit, physically normal, without any handicap or without any disease or the illness. So it is almost similar to the WHO definition of health. Statistical model consider more about the numbers. So among the 100 people, 80 people are behaving in this pattern in the given situation, then that 80 individuals are considered to be normal. The 20 people who are not behaving in a similar way like that of 80 people will be considered as abnormal. So it is more regarding the number rather than the way they behave. Utopian model is nothing but that there is no problem at all. Everything is well. Subjective model where I have to feel that there is no problem. I am not in a distress. I don't have any illness. Social model defines normalcy in the socio-cultural background. So in this culture, these are the norms that has to be followed. If that individual is not following, then that individual is considered to be abnormal. The people who are following the norms are considered to be normal. The people who are not following are considered to be abnormal. I am following certain religion, the norms are there to that has to be followed. In the other religion, certain norms have to be followed. When I am here, I have to follow certain things, the policies, the rules and regulations of this state country. If I am going abroad, I need to follow the rules and regulations of that country. Now coming to the topic. What is psychiatry? What do you understand by this subject? Definitely you would be wondering what is there in psychiatry. Those people just talk. Nothing else is there. So now let's come to the proper definition of psychiatry. So psychiatry is a medical specialty concerned in the study, diagnosis, treatment and prevention of mental abnormalities and disorders. There are different branches in psychiatry. There are child psychiatry, geriatric psychiatry, community psychiatry, forensic psychiatry, and rehabilitation psychiatry. Child psychiatry deals with more of children and adolescent. It deals with the emotional problem, abnormal behavioral problem during the childhood, or retardation during the childhood, the autistic problem during the childhood. Then there are certain problems that arises during the adolescent, the identity crisis, the behavioral issues of the teenage or the adolescent, the substance abuse that they develop during the adolescent. So this branch deals with those problems. Geriatric psychiatry deals with more of psychiatric issues associated with the old age. It deals more with the delirious disorders and the dementia and other cognitive impairments which develops during the old age, or psychiatric comorbidity associated with the physical illnesses which they develop during the old age. Community psychiatry, we deals with the psychiatric illness or the mental illness and how to prevent the mental illness in the community. Forensic psychiatry deals with the medical legal aspects of the mental illness and how to give justice to the people with a mental illness. Rehabilitation psychiatry deals with the rehabilitation of the patients who are having chronic illnesses and help them to settle down in the community. There are important terminologies which you people should be aware in psychiatry, that is psychology. Psychology is the science that deals with mind and mental process, that is consciousness, sensation, ideation and memory. We also talk about personality. Personality is nothing but a characteristic way in which a person thinks, feels, and behaves. The ingrained pattern of behavior that each person evolves both consciously and unconsciously as the style of life or way of being in adapting to the environment. We also talk about mind. So, when we talk about mind, we generally use this term very often. So, what do you mean by mind? Do we have any organ by my mind when you had been in your anatomic class? No. So, yeah, it's just something don't you have any mind? Don't you think? So, what is it? It is nothing but it's a concept. It is a functional capacity of the brain and it has three components, that is cognition, conation, and affect. So the cognition is more which deals with the thinking process, conation with your behavior or actions, and affect with the emotions. So any abnormality in these three functions can lead to mental illness. Then who is a psychiatrist? Is there a difference between a psychiatrist and a clinical psychologist? Definitely. Psychiatrist is a medical graduate who has undergone postgraduate training in psychiatry, and a clinical psychologist is a graduate who has undergone postgraduate training in psychology. Then, what is a mental illness? It's nothing but a biological medical disorder of the brain that can disrupt thinking, feeling, mood, behavior, ability to relate to others, or daily functioning. And the test for reality fails in these cases. So, when we are discussing about the mental illness, then you would be keen to know what is the etiology of the mental illness. So, when we are discussing about the etiology, it is more of biopsychosocial model. So, there are biological causes for the development of the illness, social causes, and the psychological causes. The biological causes are genetic, hereditary, then the problem with your neurotransmitters, neuron transmission, and the neuroreceptors. The psychological component is your own personality, so that and the coping skills. Social causes are the environmental factors, the stressors, the life events, the loss of a loved one, and how you deal with those environment. All these three are interrelated. Coming to the history of psychiatry, it's an old science and it was known as Bhuta Vaidya in Ayurveda in 5000 BC. The cause for this mental illness earlier in Ayurveda was discussed as hereditary, the constitution of the body fluids, which is known as pitta, and the personality. The exogenous factors that they were considering were the demons, gods, stress, and the fear. And the treatment that was provided in the olden days were either sympathizing with the patients, following certain rituals by the family members, by the community, or the fellow members in the village. Prayers that were offered to the god, demons, aversion therapy for minor mental illness like scalding and whipping. In severely psychotic illnesses, they were killed. If an insane person, if he is in mania and claims himself to be God, then he was considered and was worshipped. So, especially in cases of mania, where they have delusion of grandeur, increased self-esteem, and they have increased energy, they are able to carry out excessive work, they talk very impressively, they were considered as some sane person and were worshipped. there were many asylums which used to be placed outside the uh, town, and it was a shelter for mentally ill. Those people who were not killed or punished, they were kept in the asylums till their death in the chain, with a chain in hands and legs. I'll be discussing about certain pioneers in psychiatry, in the field of psychiatry. The first thing that you people will be thinking is Sigmund Freud, who is a neurologist from Vienna, who discussed more about who discussed about more about psychoanalysis, about the dreams, and about catharsis. But no one would have heard about the father of modern psychiatry, who is Philippe Pinel. He was a French psychiatrist and he is known as father of psychiatrists. He was the first person to remove the chain of mentally ill person in a French asylum, in an asylum in France. When he unchained, some started running to see the sunset. The other people came and hit him, and some of the insane people came and saved him. And thus, the humanity era started. The other pioneers which I would be discussing is Emil Kraepelin. He was a Swiss psychiatrist and he was the first person to divide the psychiatric illness into three categories, that is, dementia precox, major depressive psychosis, manic depressive psychosis, paranoia. Dementia precox is nothing but a modern schizophrenia where the cognitive declination takes place and they can be associated with the psychotic symptoms. The manic depressive psychosis, it is an episodic illness which now in modern era is known as bipolar affective disorder, where the person can have an episode of mania, hypomania and depression and can be associated with the psychotic symptoms. Paranoia is purely a psychotic illness. The other individual who had coined the name, who has coined schizophrenia was Eugen Bleuler. He discussed about the symptoms of schizophrenia. He spoke about the 4 A's in schizophrenia like association disturbance, affective disturbance, autism, ambivalence, accessory sensory symptoms in the form of delusions and hallucinations. If you look at the course of the psychiatric illness, the longitudinal course of the illness, you can see it can be abrupt in onset and can be just episodic in nature. It can present for only few months or years and then the individual can reach the remission. That is what the figure 1 depicts. It can be in the figure 2 depicts it is insidious in onset and longer duration of illness. The third figure depicts abrupt onset with episodic fluctuation but longer duration of illness and has not reached the normal baseline. There is a relationship between the age of onset and the illness. So, the psychiatric illness can start at a very early age, like because of your antenatal causes, perinatal causes, or injury during the birth, or intake of certain foods, or illnesses during the developmental years can lead to certain disorder. So, the disorders that can be seen at the time of birth are mental retardation, cerebral palsy. After 3, we usually see ADHD, autism. By 5, we will come to know or we are able to pick up emotional and behavioral disorder, conduct disorder, oppositional defiant disorder, and by adolescent, we will be seeing substance use disorder, schizophrenia, and bipolar affective disorder. Usually in the middle age, we see depression or any of the affective disorder, and in the late adulthood, we see dementia. Organic mental illness can happen at any age. So, as we had discussed earlier, also the biopsychosocial model. This has been shown in a graphical way, where the psychological factor, the biological factor, and the social factors which are interrelated. To give an example, I am already prone to develop depression, but I have not developed, and my environment or there can be any stressor that could have precipitated the event in the form of death of a loved one. Then there is a genetic cause, and I have a personality where I am introvert, I don't communicate much with the people, then I'm more prone to develop the disorder. So this is how the biopsychosocial plays an important role. So this is a flow in a picture which shows about the history of diagnosis, and the actual revolution in psychiatry took place in 1956 when Dele and Dineker serendipitously discovered chlorpromazine. This led to the era of change, the way we started treating psychotic illnesses, where we started to have an idea what can be the issue with these patients, what can be a biological cause for these disorders, or we were always blaming either the gods or the demons, the wrath of a demon or a god. So, with the accidental discovery of chlorpromazine, we came to know that psychotic disorder are because of the problem with the dopamine or with the dopamine receptors. And followed by that, we invented, discovered many antipsychotics, antidepressants, and which had led to the improved quality of life in many of our patients. 1990 to 2000 is known as decade of brain because lot of discoveries, inventions took place in this area. The neurosciences developed. A lot of new therapies started. They were knowing the actual etiology of certain diseases. Neuroimaging progressed in this field. So there are major categories of mental disorders according to ICD-10, which in your future classes we would be dealing. F0 to 09 uh, belongs to organic disorder. 10 to 19 is psychoactive substance use disorders like alcohol dependence, caffeine dependence, nicotine dependence, cannabis, LSD, and other psychoactive substances. 20 to 29 is schizophrenia and psychotic disorder. 30 to 39 is mood disorders, which as depression, recurrent depressive disorder, bipolar affective disorder. 40 to 49 deals with neurotic and stress related disorders, which include somatization disorder, conversion disorder, dissociative disorder. Then 60 to 69 and your neurotic and stress related disorder includes the anxiety disorder, OCD. All those fall into neurotic and stress related disorder. 50 to 59 deals with psychological functional disorders. 60 to 69 with personality disorder. 70 to 79 with mental retardation. 80 to 89 with psychological developmental disorders of childhood. And 90 to 99 behavioral and emotional disorders of childhood and adolescence. In the future classes, we will be dealing with mood disorders, schizophrenia, anxiety disorder, substance use disorder, and certain psychiatric emergencies that you would be seeing in your day-to-day life. So let's finish the class. Thank you.